mystery that cannot be explained. An enigma that defies reason. A surprising and unexpected answer. To encounter such a mystery firsthand may change your life forever. Face to face with the greatest riddles of the ages, the world's most profound mysteries reach out and touch your life in ways you never imagined possible. Extreme Mysteries.
The amazing human body is so complex, we are only now beginning to understand how it works. Yet the ancients seemed to know how it worked and how to fix it if something went wrong. And in some cases, they did it faster, easier, and certainly less expensively than we do it today. What is it that Chinese medical practitioners have known for thousands of years that Western medicine is still trying to figure out? Are there solutions to medical problems that are being systematically kept from the public? Treatments we can and should be doing for ourselves? Is there a life force so powerful it can teach the body to heal itself? And is it possible for all of us to control this mysterious life force? Could it be that the physician's own intuition and spiritual beliefs can help him know where to look and what to look for when a patient is suffering? Do all the miracles of modern medicine belong to the last half-century? Or did the ancients discover methods of dealing with their problems that give a whole new meaning to the term medical miracles? Are there yet proven methods and medicines that were used hundreds, even thousands of years ago that we can rely on today? If so, where are they? And under what name can they be found? In ever-growing numbers, people are demanding the right to be part of the healing process when something goes wrong with their body. Is this progress or a return to the Dark Ages? We'll begin unraveling the secret of these and other medical mysteries in just a moment.
The great civilizations of the past all appear to have made stunning contributions to the healing arts. Are there still undiscovered secrets they can whisper in our ear across the centuries? More importantly, are we willing to listen? After all, the modern era of medicine is surely the age of specialization, the era of enlightenment. Or are we about 40 centuries behind the curve?
4,000 years ago in Egypt, the medical care was divided into specialties and subspecialties. People then, as now, had a choice of different specialists that they would go to for eye care, for stomach disorders, for skin afflictions. Medical care in ancient Egypt was divided into two categories. The ruling elite, the military and slaves, were serviced by physicians under a comprehensive medical coverage, whereas commoners and the general public had the equivalent of low-cost HMOs.
Maybe that's where some modern politicians got their ideas for national health care. But even the ancient Egyptians were Johnny-come-latelys to the world of medical achievement. Roughly 4,000 years ago, Old World physicians used whatever was at hand that seemed to work. Trial and error was probably the primary form of medical research. But one of the concoctions they came up with really worked. It was derived from the bark of a willow tree.
The American Indian, long before the first Europeans ever landed at Plymouth Rock, used the derivatives of the white willow bark for a wide range of ailments. About the same time, the Greeks, the Romans, and even the Chinese used the white willow bark for a lot of their ailments, including earaches, inflammations, and fevers. It was first given a name in 1828 when French and German scientists isolated a compound in the white willow bark called salicin. Today, it can be purchased in the drugstore, and the product is called aspirin.
The fact is, medical history is brimming with miracle drugs that were first discovered by some ancient people.
The Avaro tribe of the Amazon, unable to read or write, discovered quinine, the only treatment for many years for malaria, and they discovered curare, a poisonous agent which we use in anesthesia to relax muscles. In ancient India, the moonshine plant, or wolfia, was widely used and revered by the holy men as a wonderful drug to treat snake bite, diarrhea, fever, dysentery, and especially for a sedative in mental illness. But the modern Western physician was slow to accept this so-called folk remedy. It wasn't until 1952 that a full-fledged study of the Rauwolfia plant brought about a revolution in the use of this age-old tranquilizer.
Could it be that we're not quite as smart as we think we are? Between 1600 and 1500 BC, an Egyptian papyrus listed something in the neighborhood of 1,000 remedies. Surprisingly, over half of them listed as one of the important ingredients, honey. But what possible medical benefits could come from honey? Surely it was just the ancient equivalent of a little bit of sugar to help the medicine go down.
In fact, it's much more than that. Honey is one of the most interesting and complex substances ever studied by man. It helps to combat all kinds of infections, even those which are drug resistant, and it also helps to expedite the healing process. Honey, as the ancient Egyptian and Sumerian physicians knew, is a potent killer of harmful bacteria. You know, it contains an enzyme that combines with oxygen and glucose to form hydrogen peroxide, which is a powerful disinfectant. And since honey can kill bacteria, it obviously resists decay. A number of years ago, archaeologists working in the tombs of ancient Egypt unearthed 2,500-year-old honey that had retained its consistency, its color, and its stickiness.
Next time you spread some honey on your toast, give a little tip of the hat to the lowly honeybee and some ancient apothecary who discovered the bee's product not only tastes good, it can make you feel good as well. Can it be that there are still sources of practical, inexpensive, healing and preventative measures available, sources that may be thousands of years old, but are recognized today as part of the holistic approach to medicine? Could it be that there is more to medicine than just, well, medicine? Is it possible that ancient physicians discovered that there is a connection between the body, the mind, and spirit? Early in the 2nd century, a man by the name of Zhang Zongying stood by helplessly while most of his family, including a beloved daughter, were wiped out by a severe epidemic. This great personal tragedy brought Ging to a fateful decision. He would pursue a life dedicated to the healing of the sick. It was too late to save his own family, but he could perhaps save others.
他怎么了？
他的气虚血弱，能治他吗？把这个熬了。
Among other things, Ging used a medical practice already ancient 2,000 years ago. It would come to be known as acupuncture.
大的整体厉害。 我行医是为了纪念我的女儿，可惜我的医术已经救不了她了。我很荣幸您能够让我来治您的女儿，我应该感激您才是啊。
Besides the practice of medicine, Jing was also a scholar. He compiled a classic of Materia Medica in 220 AD that today is still used by Chinese physicians that have access to 5,000 years of medical wisdom from this land. Included in that work is an explanation of acupuncture, the practice of placing long, very thin needles at very precise locations along what are called life force meridians. This relieves blockages of the flow of all the important life energy Orientals refer to as qi.
Acupuncture has been practiced essentially in the same way for 5,000 years. It is based on the Taoist principle of yin and yang, two opposite yet complementary forces in the universe. When yin and yang are balanced, the result is harmony. The purpose of acupuncture is to restore the balance of yin and yang in the life force, which we call qi. It incorporates, in a very real sense, body, mind, and spirit. In ancient times, people were close to the earth. They watched the stars, the coming and going of the seasons, the migrations of the birds and the animals. They saw great wisdom in this and developed their lifestyle and a healing form such as acupuncture on these methods. If these methods were ineffective, they would have died out long ago.
The art of acupuncture was mentioned in some of the earliest writings that have ever been discovered. One early record tells of an ancient physician named Bian Qiu that supposedly raised a young prince from the dead. The fact is, a number of Western physicians have found that acupuncture works extremely well, and they have included it in their own practice. Indeed, today acupuncture has taken on a somewhat tenuous but very real place in modern medical practice as more of a complementary discipline as opposed to simply an alternative healing method.
The notion of qi and qi flow is probably the single most important concept in traditional Chinese medicine. It's important that Westerners remember that acupuncture is just one of many treatments that make up a much larger body of Chinese medical belief and treatments. These treatments are based on many ancient ideas. However, many of these ideas are in conflict with what science knows today.
It is often difficult for 21st century minds to accept the notion that treatments used thousands of years ago might offer solutions to some of our most troubling problems today. After all, if we can fly to the moon and walk on its surface, shouldn't we know more than Stone Age cultures about our own medical woes? Is it just remotely possible that we could solve many of our medical problems by taking a giant leap backwards?
Chinese medicine is approximately 4,000 years old, which denotes true tradition. Western medicine in its current form is only a few hundred years old. Chinese medicine sees the body as being energetic, whereas Western medicine sees the body as being more physical. Chinese medicine, because it sees the body as energetic, treats illness and disease from the point of view of getting to the root cause as well as treating the symptoms. Whereas Western medicine, seeing more the physical aspects of the disease, treats more the symptoms.
Are today's alternatives yesterday's conventional cures? Some astonishing discoveries lie just ahead. Today, the hot new buzzwords are alternative medicine and the mind-body connection. They are usually taken to mean some medical, some say pseudo-medical practice that is an alternative to what has become the traditional practices of the day. It is interesting to note that historically, what is traditional and what is alternative often change places. For example, in Germany in the 18th century, Samuel Christian Friedrich Hahnemann, a chemist and physician, became disenchanted with the medical practices of the day. He was so fed up, in fact, that he quit his medical practice and became a medical translator. One day, he stumbled onto a reference to the ability of a certain Peruvian tree bark to cure malaria. Hahnemann decided to see what would happen if he drank a mixture made from this same bark. The result was completely unexpected and frightening. Almost instantly, he came down with all the symptoms of malaria. Hahnemann had stumbled upon an ancient principle of medicine first expressed by Hippocrates himself, that is, like cures like.
Basically, what Hippocrates had determined roughly 2,000 years earlier was that to effect a cure, a physician would pick a substance that caused roughly the same symptoms of the disease.
This became the fundamental principle of what Hahnemann named homeopathy.
Homeopathy sees symptoms as the body's natural response to fighting illness, and the homeopath uses those symptoms to guide them to exactly the right medicine, which has been proven to be able to mimic those symptoms of discomfort in the whole of the organism. The medicine is then given in very tiny, minute doses, because less is best in homeopathy, and it's just sufficient in order to kickstart the very delicate vital force into curing itself.
This is not substantially different than the process of vaccination, which coincidentally was discovered by Edward Jenner at almost the same time.
The practice of homeopathy quickly took hold in Europe and came to America from Germany in the 1820s. The American Institute of Homeopathy was established in the 1840s, and by 1910 there were 22 homeopathic medical schools 100 homeopathic hospitals, 1,000 homeopathic pharmacies, and 14,000 homeopathic physicians. The reason that homeopathy was accepted was simply because it worked. In the plague-ravaged Europe and in the cholera epidemics of the 1830s, those people who were being treated by homeopathy got better at a rate 3 times that of those being treated by the orthodox medical practice. Similar success against the yellow fever, cholera, and scarlet fever epidemics that swept through America in the early 19th century brought about swift acceptance.
And while huge medical breakthroughs in hygiene, surgical techniques, and drug therapies all but erased homeopathy from the American scene, the fact is, it is still the most widely practiced therapy in the world today.
In fact, the British royal family have been using homeopathic medicines for 150 years, and both France and Germany boast hundreds of homeopaths and homeopathic pharmacies.
Homeopathy appears to be enjoying a resurgence in America today, and that being the case, it might be a good idea to find out what else Hippocrates had to tell us.
Hippocrates, the famous Greek physician, is generally credited with helping to found Western medicine. He got most of his medical knowledge from the ancient Egyptians. And it's interesting to note that he took a holistic view of treatment. In his writings, Hippocrates focuses on the general health of the patient as opposed to specific illnesses. For him, prevention was better than a cure. He prescribed fresh air, water, exercise, rest, and moderate diet. By the way, walking was a recommended exercise for the sedentary couch potato. Hippocrates hasn't been around for a few thousand years, but if you've had a checkup lately, you'll find that what the doctor tells you sounds a lot like what he prescribed in his day.
The Romans also made some astonishing discoveries. No one has been able to figure out how he came to his conclusions, but in his notes, the Roman physician Vario appears to be writing about the effects of germs.
Precautions must be taken in the neighborhood of swamps because there are bred certain minute creatures which cannot be seen by the eyes, which float in the air and enter the body through the mouth and nose and cause serious illness.
Vario could not possibly have seen these minute creatures, so how could he have known they were there? We've mentioned that the ancient Egyptians and the Chinese did some remarkable curative things, but we only touched the tip of the iceberg. Both the Egyptians and the Chinese, for example, used the mold from bread to prevent infection. In point of fact, many ancient healers used antibiotics against infection. And what boggles the modern medical mind even more is the fact that several ancient cultures even developed antiviral vaccines.
Just as ancient physicians had discovered a form of penicillin in bread mold, the Africans had discovered a way to prevent smallpox. What they would do is take the pustule from an infection, put it on a thorn, and inoculate themselves. And in the process of this inoculation, a majority of the people would not get smallpox.
In the 16th century, Europe fell into the terrible grips of the Great Plague. It is estimated that over 1/4 of the population in Europe was killed.
Nostradamus, a first-rate physician for his time, created one of the only successful cures, an odd concoction of rose petals, sawdust from green cypress, cloves, iris, calamus, and resinous aloe. His contemporaries undoubtedly accused him of alternative practice, but the fact is, many of his patients survived. Being a studious man, he may have found this cure in an ancient medical text, or he may have known that certain herbs and plant extracts cause the body to react in certain ways, and put together a combination to suit the symptoms. In any case, it worked.
If this information was so easily available that even Nostradamus could find it several hundred years ago, why had traditional Western physicians and scholars never sought it out? Could it be that there was something else involved that made them shy away from the data?
Spiritual belief was always an important part of the healing art. In fact, in many ancient cultures, the priests were also the healers, because the mind and the body and the spirit were all intertwined in their belief system. Unfortunately, today, those two things are not only separate, but often antagonistic to each other.
Then, of course, there is the natural pharmacy we are only beginning to hear about.
I've had an extraordinary opportunity over the last 20 years to live with my family in small villages in the Samoan Islands and to see firsthand how healers use plants to treat illness. I collected and analyzed in the laboratory over 100 different plants that the Samoans used to treat disease, but the one that got me the most excited was the bark of a tree that they used to treat hepatitis. I knew that we have very few drugs in Western hospitals that can treat viral illness. I sent samples of the plant and the healer's potion back to my colleagues at the National Cancer Institute. They wrote me back with considerable excitement. They had discovered a new molecule called prostratin that showed activity as a potential anti-AIDS medication. Prostratin also showed activity against other viruses and may exhibit few side effects in clinical trials.
A very unique and ancient plant that we're studying is a vine called Uña de Gato, or cat's claw. It's been used for thousands of years for the purpose of bringing together the spirit and the physical body as an immune stimulator or to build the body defenses. Today, we're studying it because it shows activity against breast cancer cells and also as an antibiotic.
These are cordyceps, a rare mushroom found in the highland plateaus of Tibet and China. They grow on a caterpillar. There's a legend in China that invading warriors noticed that the yaks in this region could run much faster and longer than the warriors' yaks. They reasoned that because the natives' yaks were eating this mushroom, they were deriving their stamina from it. For a while, the mushroom became quite popular in Tibet. The Emperor of China found out about it. From then on, by imperial edict, nearly all the mushrooms had to be sent to the emperor and his court physicians. Today, it's so rare that it's illegal to take the mushroom from the mountains without a government permit.
How long has mankind been using herbs? No one knows for sure, but the oldest known human corpse, the Iceman, who was discovered frozen high in the Alps of Europe, had in his leather pouch an antibiotic mushroom. Could it be that even his culture had an advanced knowledge of a healing art?
Well, when scientists opened his leather pouch, one of the things they found was a type of mushroom known to have antibiotic and laxative properties. What this suggests is that people of this time may have recognized this mushroom for its use in treating infectious diseases. Researchers spent many years trying to cultivate this strange little mushroom, cordyceps, so that it could be developed for widespread use. Now their goal is to study the cultivated form and uncover its health benefits.
Scientists the world over are combining the latest technology with ancient wisdom. For example, breast cancer experts at the University of California at San Francisco are doing an unprecedented clinical trial using Tibetan medicine as the sole therapy for advanced breast cancer.
This is a study for women with advanced breast cancer. They will be receiving Tibetan medicine as their only treatment. Tibetan medicine is an ancient form of medicine that has been practiced for over 1,000 years. It relies on a diagnosis made by the pulse and an examination of the tongue, and then the use of herbal formulas. Women on the study will be followed closely as they are on other clinical studies to see if their cancer actually responds to this treatment.
If we can learn to be more open to the teachings of the past, could we learn to be more accepting of things in the future?
Native peoples have an important message for modern medicine. They've discovered over thousands of years that the plants and even the animals that surround them have important healing properties that can be used to treat serious disease. And without exception, I've found that indigenous peoples believe that the plants and animals are sacred, that they're worthy of respect and worthy of conservation. The work of my colleagues and myself has shown that indigenous people have, in fact, many potent molecules in the plants they use, molecules that can be developed as modern drugs.
Everyone would welcome a vastly improved medical practice, particularly the patients. The question is, will it include the old wisdom along with the new technologies? After all, we are a combination of body, mind, and spirit.